Title: Advancing Critical Care Pharmacy Practice, a Comprehensive Approach to Burn Cases. Introduction. Good morning/afternoon/evening, esteemed clinical pharmacists. Today, we delve into a crucial aspect of critical care pharmacy practice, the management of burn cases. Burn injuries present unique challenges in critical care, requiring a multidisciplinary approach for optimal patient outcomes. Join me as we explore the intricacies of diagnosing burn injuries and discuss pharmacological and non-pharmacological treatment modalities to provide comprehensive care to our patients. Diagnosis of burn cases. Diagnosing burn injuries accurately is essential for guiding appropriate treatment strategies. Burn severity, depth, and extent must be assessed using standardized methods such as the Rule of Nines or the Lund and Browder chart. Additionally, clinicians must consider associated injuries, inhalation injury, and comorbidities to develop a holistic understanding of the patient's condition. Pharmacological treatment. 1. Pain management. Utilize multimodal analgesia to manage burn-related pain effectively while minimizing opioid-related adverse effects. Options include opioids, nonsteroidal anti-inflammatory drugs, NSAIDs, and adjunctive therapies like gabapentin or ketamine. Consider regional anesthesia techniques such as epidural analgesia or peripheral nerve blocks for targeted pain relief in specific burn areas. 2. Wound care. Select appropriate topical agents like silver sulfadiazine or mefenide acetate for wound decontamination and infection prevention. Incorporate advanced wound care modalities such as biosynthetic dressings or negative pressure wound therapy to promote wound healing and minimize scarring. 3. Infection prevention and treatment. Initiate prophylactic antimicrobial therapy to reduce the risk of burn wound infection, guided by local epidemiology and susceptibility patterns. Start empirical or targeted antimicrobial